The Head and Neck Anatomy program from eHuman is a program that can enhance the learning of any student who is studying head and neck anatomy, as well as professionals who are reviewing this complex area of anatomy. It is also an excellent resource for those who are teaching head and neck anatomy, as there are a plethora of exceptional 3D resources that can be used in class to illustrate anatomy and help students visualize the relationships of the different structures. The program also can be used by educators to stimulate exceptional interactivity in class through the quizzes that I'll demonstrate in just a second. So let's take a brief journey through some of the resources in this program. I will begin with the skull osteology section, where we have the capability to bring up a 3D skull. We can zoom this in, we can rotate it around. We have the ability to click on any skull bone, and it will highlight that bone in its relationship to the rest of the skull. So again, going through each of these bones, allowing the interrelationships, which bone is which, to be determined. There is an exploding skull that takes the skull apart. We can zoom in, we can look at the complex interrelationships of the various bones to each other. We have a foramina, canals, meatuses, and fissures 3D program that allows you to come in. You can look at all of the foramina that are present in the skull. We can click on any one of these, such as the foraminal valley. The skull goes transparent, and then we can look, see where that particular foramen is located. There's the skull suture 3D program. Again, same thing. We can rotate the skull. We can click on any particular suture, and it will show that suture to us. We can rotate it around and take a look at it. So again, any particular suture in the skull can be viewed. One of the interesting parts of this, the skull osteology quiz, because in here you can bring up a particular view of the skull, the frontal view. We have on the left all of the bones that comprise the skull. So the object here would be for me to highlight the frontal bone, then go find it on the skull. So if I think that's the frontal bone, I click on it, nothing happens. When I click on the correct bone, it labels itself, checks it off from the list on the left-hand column. So again, we can go through and label each of the bones, checking to determine if we learned the correct information from the 3D program. We can go into the reference library, and here, as you click on a bone, any of those bones label themselves on the picture, or we have the capability to turn all of the bones on and look at them. So we can do this from any particular view of the skull and see where the bones are and how they relate to each other. Great tool for interactivity in class. There's a skull sutures quiz, the same methodology where we click on a frontal view, and here again, if I wanted to find the intermaxillary suture, I would highlight that, then I have to go locate it. If I think that's it, nothing happens. When I get to the right one, it clicks itself off. We have, again, the reference library where I can turn on all of the sutures. So again, all the different views of the skull that would allow us to see each of the sutures of the skull. There is a foramina, canals, meatus, and fissures quiz where I can go in, and here lists all of the particular foramina, meatuses, canals, and fissures that are located in the skull, and the object would be for me to identify the one that's being shown in the picture box on the right. We again have the reference library, and here I can click on any one of these. It tells me what I'm seeing in the right-hand box, as well as the textual information that you would typically find in any of the textbooks. So again, we can go through all of this and make sure that we know all of the canals, foramina, meatuses, and fissures. In the temporomandibular joint anatomy section, there is a very well done animation that shows the complex interactions that occur in this very unique point of the skull. There is also a 3D program where you can bring up, and this has all of the bones that have a relationship to the temporomandibular joint. I can click the build the TMJ, and then I can build any particular component one at a time to show someone how this complex structural joint is layered. So I could put a capsular ligament in, but I would probably start with an articular disc since that's on the inside. We can zoom in, we can rotate around and look at that. I can add the discal ligament that attaches it to the mandible. I could surround it with a capsular ligament. I can unclick that. I could add in the inferior lateral pterygoid, superior lateral pterygoid. So here you can see that all of the structures that would ordinarily form part of this complex joint, including the particular ligaments that attach the mandible to the skull. So this way you can build it up and a student can see how this structure is designed. If we go into the muscles and ligaments section, here there are wonderful animations that show the muscles of mastication from various views. We can take a lateral view where first of all the masseter muscle disappears, then the temporalis muscle will disappear to reveal the lateral pterygoid muscle underneath. There is a quiz here of attachment locations. We can again go into this from a frontal view, and here are all of the muscles that would be attaching to the skull from this particular view. So if I were to highlight the buccinator, my job is to find where the attachment location is on the skull. So I can wander around, and when I eventually think that I have the right location, I click on that, and again, it checks it off from the list. Or we go to the reference library where here, every particular one that I click on highlights itself, and then I can press the information button and receive all of the information that would be typically found in a textbook relative to the muscle attachment as well as the function of that particular muscle. I have the ability to turn on all of the labels so we can see all the muscle attachments from that particular view. And the last area I want to show are the cranial nerves, because there's a wonderful 3D program in here that can be rotated around, it can be zoomed in and out, and we can then turn it around, even look at the interior of the skull, pick out any one of the nerves, such as the optic nerve. The remainder of the nerves and skull bone become apparent, and we can then see the relationship because this nerve maintaining its opacity. So we can go through each one, and if you note at the bottom, the text box tells us all about this nerve, the typical information that you might find in a textbook. So again, to learn the complex interactions of the cranial nerves is a wonderful resource. There are also well done illustrations here that show the skull with all of the branches so that we can take this, we can study this particular, the trigeminal nerve, all of its branches. We can see the foramen, we can see where all the branches are located. They're all wonderfully colored. So again, through each of the cranial nerves. So I think from this demonstration, you can see that this is a program that has a rich group of 3D resources, as well as all of the textual information you would find in a textbook, making it a tremendously valuable resource for the learning of students, as well as for teachers to use in class to illustrate and show the complex 3D relationships that exist in head and neck anatomy.